Dereta, dereta, dereta. Stoppa, stoppa, stoppa. Muovere, muovere. Hop, 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 hop. Non muova. Ah, l'asparagus.
Hey guys, what's up? It's Stephanie and welcome back to my channel. So in the video today, I want to discuss my surgery rotation. So I'm in my winter break, as you can tell by the Christmas tree in the background. I'm currently visiting my husband who lives in El Paso. So I just finished my surgery rotation literally like three days ago. So I just finished my surgery rotation and I wanted to talk about how my surgery rotation went for those of you who are interested. I got a lot of questions about me making videos in regards to each rotation. So here it is, just basically overall how my surgery rotation was. So my rotation was 5 weeks long, usually a month, and my doctor worked Monday through Friday. Of course, he also worked weekends, but we were required to only go Monday through Friday, and he only required me to go Monday through Friday. He would have surgery days all day on Monday. He also had surgeries on Thursdays and Fridays, but he also had clinic in the mornings. So Monday, Thursdays, and Fridays he had surgeries, and Tuesdays and Wednesdays he had clinic. Now my doctor saw so many patients. He probably would see around 60 patients a day, and it was just a lot. And he was very, 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 very quick with his patients, probably 2 minutes per patient. And he's actually the director of the hospital where he works at, so he was just multitasking all the time because he had to go for meetings or had to go handle other situations, etc. So sometimes he was in between rooms, would go get a phone call, be gone for a few minutes, come back and keep seeing patients. Most of his patients that he was seeing were either pre-op or post-op. My doctor also specialized in hernias, so he was a master of hernias in the Valley and a master of mastectomies and just breast cancer in general. So most of the cases that I saw with him were hernias or mastectomies. Now, Monday, I would go in at 6 a.m. I would be there by 6 a.m. because his first surgery was scheduled at 6:30. Now, did he start at 6:30 all the time? No, he didn't. Sometimes he would start at 7:30. There was one time that he started at 8:30. I remember I got there at 6 and I was just exhausted because I was waiting. And finally at 8:30 he started. But most of the time, yes, he would start his surgeries around 6:40, 6:50. But there were times where he was just running late because he had a meeting or just something that happened that he needed to attend to. And I would get there by 6 a.m. until around 10 or 11 or even midnight sometimes on Mondays. And Fridays he had a clinic in the morning, so I would go to clinic at 9 a.m., be there with him until about 1, and then I had a 2-hour lunch break, come back at 3, and he would have surgeries from 3 till sometimes midnight or 11 or 10. And then Thursdays it was basically the same thing. He would have clinic from 9 to 1, have a 2-hour break in between, 3 till around 10 or 11 or midnight, he would have surgeries. And then Tuesday and Wednesday, he had clinic, and he would have clinic from around 7:30 to 6 p.m. So I would get there around 7 a.m. So 7 a.m. to about 6 p.m. I would leave. That was Tuesday and Wednesdays. My doctor was just a workaholic. He did a lot of stuff, and so the clinics that I shadow him with, he had Stu clinic, he had a surgery clinic, and then on top of that he had a vein clinic. So in the vein clinic he did a lot of procedures, he did a lot of vein ablation, he removed veins, so varicose veins, patient that had venous insufficiency, etc. So he skipped in between clinics. Good thing these clinics were in the same building on the same floor, so it was literally like just walking across to the other side of the floor. So he walked in between back and forth. So Monday it was surgery patients all day, and then Tuesday and he would switch half day in the vein clinic and then the other half in the surgery. So that's why he had a lot of patients on his surgery days, because he also had to split that time in between his patients for the vein clinic, and then of course the surgeries also. And so usually what would happen is that on Mondays I would get there at 6 a.m. I would go to the female lockers room. There was a locker room that I shared with the CRNAs and also the student RNAs, and also the residents. So I would go in there, change. My scrubs were different color than the staff that worked in the OR, the nurses, the technicians, etc. They were different colors, so you could tell who was residents, who were students, who were the surgeons, who were the CRNAs, etc. So I would go and change. I would change in the locker room. I would usually come in and just scrubs just in case my doctor had to go to the clinic afterwards, and I would also make sure I brought my white coat with me. So I would go and change in the locker room, come out, and then I would make sure that you always have to have a head cover, like on your head, covering all your hair before you went out. So I had that, and then I also had booties, so you had to make sure that you covered your boots before you entered the OR, and you had to be in scrubs. So this was very, very strict for you to enter the OR area where the nurses were, where they had all the patients, etc. So you had something covering your hair, and you had to be wearing scrubs, and the scrubs that were required from the hospital, and then on top of that, wear your booties. So I always made sure I did that. And what I would do every morning is that I would change, go to literally right when I went out of the locker room, I would go to the board. So they have a board like Grey's Anatomy and all those medical movies about surgery and shows, where they have a board with all the doctors' names, and then they have what procedures they're going to be doing and what room they're going to be doing. So my doctor never told me what time he would have his surgeries or what type of surgeries he would have, or he didn't tell me anything. So I really relied on the medical assistant that worked with him at the clinic. So I would make sure I would ask her, I got her phone number, I would ask her, hey, does the doctor have any surgeries today? She would be like, yes, he's starting at this time. Or when I was in clinic, I would make sure and see what surgeries he had at what time, so I could be sure I would follow him during that day, because there was weeks where his schedule was just like all over the place. I remember there was one time where I woke up at 6 a.m. because I thought he was gonna have surgery. And so I got to the hospital at 6 a.m. I went to the board and I didn't see his name on the board. And so I asked one of the nurses, I'm like, hey, is Dr. etc. going to have any surgeries today? They're like, no, he canceled. And I'm like, okay. And so then I went and I texted the nurse, and she's like, oh yeah, he canceled because he has clinic today at 9. And so I told myself, okay. So I had to go home, bring my white coat with me, make sure I change and I look good, decent for clinic, because usually when I went to the OR, I just put my hair up, and sometimes I didn't wear makeup because, I mean, you have your face covered most of the time. That was just me. And when I'm in clinic, I make sure I look pretty decent. I have my white coat, and I'm groomed, etc. So I had to go home, change, and then I came back to the clinic. So sometimes the schedule would just change. So I always made sure that I looked at the schedule beforehand with the nurse, or I texted her. She was very, very helpful, letting me know where he was, what he was doing, etc. So on Monday, sorry guys, I tend to like trail off. So on Monday, I would go and look at the board, and it would tell you what room he's going to be in and what the procedures are going to be. So I would go to that room, and sometimes I would see that the room was just empty. So that meant that the patient wasn't there yet. So then I would go back and I would sit in the lounge, or I even go to the staff's break room, and I would just sit there and just go through my flashcards or study and just poke my head out and go see every like 30 or 20 minutes to see if the patient was ready. And so I would, and when I would see the patient was already in the room and he was being anesthetized, etc., I would go and get my stuff to scrub in. So I would go and get my gown for my size, I would go and get my gloves. Make sure that you know your glove size, because when you would go, they have different glove size and different sizes of gowns, so make sure that you know your glove size. So I would go grab my gown and my gloves, go inside the room where the patient was being prepped, and I would ask usually the technician, can I scrub in for this procedure? And they would ask, did you ask the doctor? My doctor was very cool. He didn't mind me scrubbing in at all. So I would tell them, yes, I did ask the doctor and he's okay with it. So she was usually the techs would be preparing the table for the patient and their instruments that they're going to use for the procedure, and usually they would be sterile. So I would be very, very careful to open my gown and open my gloves and place it on the table. Make sure I do not contaminate anything at all, because you do not want to contaminate, especially if they have the entire table with all their instrument that took them about a while to set up, and you come in there and you contaminate it, it's going to piss them off. So I always made sure that I did everything clean. And then when I went in, before I went in, I would make sure that I would scrub in. So you're scrubbing in, and then when you go in through the door, you make sure that you go like this, and you always have your hands up like this the entire way we were going in. And sometimes some of the techs would help you gown, sometimes they wouldn't. So make sure that you know how to gown yourself, or else you're gonna get chewed out. So I made sure I knew how to gown myself by myself. Sometimes if the techs were busy, and just gown yourself, put on your gloves, etc. And then the entire time I'm walking like this, and I would just put my hands down and just be standing there waiting for the doctor. Sometimes we would wait about 15 to 20 minutes for the doctor to appear, because sometimes he was in a meeting or he wasn't at the hospital yet, or etc. So we would just be there in septic technique, just waiting for the patient. And sometimes I would just be like that when I'm waiting, or just put my hands on the patient, making sure I don't touch anything around me. Now during the procedures, he would have residents with him, but he treated us the same. Residents and PA students, my doctor would treat us the same. Of course, the residents would do a little bit more, but he would sometimes just let us suture, like closing up the patient. Same with the residents that were there with me, or put glue when you're closing up the patient, etc. But most of the time when it came down to the procedures, like when he did hernias, I was just there standing and observing, and he would point like certain anatomical features and tell me, look, this is where the subclavian artery is, or this is where the mesentery is, or etc. He would just point at things and just show me. But most of the time I just observed. When it came down to closing the patient, that was the only time where I was able to touch the patient. I sutured the patient up and also applied glue. But yeah, basically for the procedures, they were very, very interesting. Now, how long did the procedures last? It really depended on what type of procedure he was doing. So usually when he did hernias, they probably lasted about an hour, depending on whether he did it laparoscopically or he did it open. It was also really interesting to see robotic surgeries. So Da Vinci Xi is or Da Vinci 11 is used a lot in the OR, especially for like small procedures. And my doctor used it a lot for hernias. And they have a very good prognostic feature for patients. Patients actually feel a lot better after surgery in comparison to an open surgery or a laparoscopic surgery. So it's really good, and it's not as invasive as other types of surgeries for hernias. So I was able to see my doctor do these, which I thought was pretty interesting. He literally sits behind a machine and he's like moving it like this, and he's moving it with his fingers, and on the other side the machine is just doing the surgery for him. I thought it was really interesting. He allowed me to sit on one of them and see, and it literally looks 3D. It's just amazing how far medicine has gone, and I really, really enjoyed these type of surgeries because it was just so interesting. So these lasted about an hour. Like I said, the most was like an hour and a half. The ones that lasted a lot were the mastectomies. So what are mastectomies? Mastectomies were usually done on patients that had breast cancer, or just wanted to remove their breasts for some type of mastitis, or for example, they have a family history of breast cancer. So my doctor did a lot of these, and these lasted really long, especially if there were double mastectomies. They usually lasted about 4 hours in total. 2 hours just for the doctor to remove the breast tissue, and then another 2 hours for the plastic surgeon to come in and replace the breast or do a reconstruction on the breast. So it was 4 hours in total. So these surgeries lasted a lot. I remember I would be on my feet, and my feet would just hurt so much by the end of the day. So what I ended up doing is that I ended up purchasing compression stockings, and I would wear those all day, and they really helped, guys. So I really, really recommend that for just if you're gonna be standing a lot, like surgery. I really, really recommend the compression stockings. So I made sure that I had my compression stockings on, and I wore them every time for surgery. And especially for these long surgeries, like 4-hour procedures, we're just standing there, or like the mastectomies. And it was interesting because whenever he did the mastectomies, it was like blood everywhere. Specifically if he like hit an artery, it was just like all over. So that's why it's really important for you to wear sometimes like a face shield, because sometimes it can get on your face, and also your glasses. So I wear glasses. If you haven't seen my other vlogs, I wear glasses, and in surgery I would wear glasses. And another thing that was very, very annoying is that sometimes your head is just down the entire time, and my glasses were just like falling, and you can't touch yourself at all because you're septic. So make sure that you either wear contacts, or you make sure that your glasses are tight and they're not slipping off you. So sometimes like that, I would have to remove and tell the nurse that was not gown, hey, can you push my glasses in for me? So they would go and push my glasses in for me. There was times where my glasses were just right here, and the doctor would just say or mark like, hey, your glasses are falling. I'd be like, oh crap. So I would go and tell the nurse, and she would put the glasses back for me. But yeah, also with your booties, which is like a covering for your shoe that you would put on. Really important because, like I said, procedures like these, like the mastectomies that bleed a lot, there will be blood all over the floor. And you don't want to get blood on your shoes. So yeah, these were some of the things that he would do a lot that had a lot of bleeding. So that's why it's really important to make sure that you gown yourself properly, etc. And yeah, so the mastectomies, he did a lot of hernia repairs. I also saw some cholecystectomies, which is where he would go and remove the gallbladder. And these were also done laparoscopically, but most of them were hernias and mastectomies. He did a lot of mastectomies. So that's why usually Mondays were really long, because he would have 3 or 4 mastectomies, and those took forever, guys. So, I mean, 4 hours each one, they took a long time. But it was really, really, really interesting to see. It was really interesting because I'm so accustomed to seeing cadavers and being able to see the tissue, like live tissue, and just seeing that bright, beautiful color. It really caught me off guard the first time I saw it. And so, yeah, so I enjoyed my surgery rotation. I really did, but it's not for me. I know some of my classmates that were not looking forward to surgery and did surgery. They're like, you know what? I want to go into surgery once I graduate. But just for me, it's not for me. I want to be able to do emergency medicine, different types of procedures. So it was just not for me, but I really did enjoy the rotation. My preceptor was amazing. Like I said, he treated me, the medical students I was with, and the residents the same. He didn't treat us inferiorly or etc. He treated us all the same. We did the same procedures. We were all on the same level. The residents were very, very nice. I don't think there was a single resident that was very mean to me. They were all very nice. The days that he had clinic, usually he had a resident with him and myself. So he would both send me and the resident to go see the patient. And we would go and see them and would go and explain. Of course, my explanation or my presentation of the patient to my doctor was not as good as the residents, but he was very, very understanding of that and was just very nice. And the vein clinic was also very interesting because I was able to see procedures like vein ablations, phlebectomies, etc. So that was also very, very interesting. It was a very tiring rotation because by the end of the week on Saturday, I just wanted to sleep. And to be honest with you guys, sometimes I didn't sleep at all because you were in surgery so much, and then on top of I needed to study. Surgery rotation exam is one of the hardest exams for all the rotations in general, and I was studying so much for that rotation. So every weekend since the rotation started, I would wake up at 9 and study from 9 to like 9, literally like every Saturday and Sunday, because sometimes I didn't have time during the week to study because I was just so tired trying to recuperate from the previous day if I had surgeries. I would go and take naps. So I made sure that on the weekends I did all my assignments and I studied, and it really paid off, guys, because I got an 85 on my EOR. And so 77 is usually the national average for the EOR for surgery, and I got an 85, so I was really, really proud of that. And also I lost 8 pounds my entire surgery rotation. Yeah, I lost 8 pounds my surgery rotation because sometimes, like I said, I didn't have time to eat at all. I learned to buy meal replacement drinks, and they're called Huel, so I'll add the link if you guys are interested. I'm not getting money whatsoever from these. It's just sharing my experience. One of the residents that I was with recommended it for me because she also said that sometimes in between surgeries she didn't have time to eat. She would just drink this and it would fill her up the rest of the day. So I ended up trying them and I love them. I got my husband hooked on them also, and they're nutritious, etc. Yeah, I'll add the link on the bottom. If you guys like it, make sure you check the website. And so I would take these on my surgery days, and in between breaks I would go and just drink these or just bring snacks, and I was good because there was days, the first few weeks, I didn't get to eat at all. Sometimes I made the mistake of skipping breakfast because I was trying to fast because I'm trying to lose weight, and that was a big no-no because I would miss breakfast and I wouldn't eat until 7 or 8 p.m. So I was starving the entire day, and it's just awkward when you're standing in surgery and your stomach is just making all these bowel movements. So yeah, I made sure I bought those meal replacement drinks and I just drank them on my surgery days that were really, really long. I made sure I brought my waters with me also. You don't want to get dehydrated. And also make sure you have good shoes because your feet are gonna hurt once you get home because you're standing all the time. But overall, it was a great experience. And for those of you who are interested in surgery, I hope you guys have a good experience also. So if you guys have any questions for me or anything like that, make sure you comment below. I hope you guys like this video. If you guys have any feedback or anything like that, or just questions for me personally, make sure you send me an email and I get back to you as soon as I can. Sometimes, guys, some of my rotations are very demanding. Like I said, surgery was very demanding. I rarely had any time for myself. During that entire rotation. It flew though. It flew so fast because I was keeping myself busy all the time. But sometimes I don't check my emails or my Instagram messages, but I will respond to you guys as soon as I can, okay? Alright guys, thanks for watching my videos and I'll talk to you guys later. Bye.